Hello, I'm Dr. John Kruse, and welcome to today's question and answer hour. So, during this hour, I will attempt to answer questions on the videos released this past week on ADHD in general and on broader mental health questions. So, if you have, and that can include personal medication questions. The caveat or warning or framework is that the information I provide is for general informational purposes. I'm not making specific recommendations since I haven't done a thorough medical evaluation on you. And I will review the video, which is just a sound re-recorded video, and then move on to, looks like there's already several questions here. So the video release, oh, one other housekeeping announcement. Next week will be after the US changes daylight savings time. So I will be sticking with mainland USA times, which are, I think it's 9 o'clock now on the West Coast, noon on the East Coast. So I'll be messed up an hour in Hawaii, and our European audience will be off an hour until they switch in a few weeks. So the sound recorded was about white noise and ADHD. So white noise is by definition a full spectrum of the audio spectrum that humans can hear. So a exposure to high frequency, low frequency, everything in the middle. And brown noise, in contrast, is full spectrum. It includes all those spectrums, but with greater emphasis on the lower, deeper, rumbly sounds. So many background noise screening devices use a white sound generator. Many people found a brown noise more soothing, more relaxing, more comforting. And on the internet, particularly TikTok, there was a big surge about 2 years ago. It hasn't gone away yet, but listening to it for hours helps them with focus, concentration, decrease. Seeing I'm having connection problems, I hope I'm back. So brown noise and white noise in general, the claims online are can help with focus, concentration. It can help with feeling more relaxed and comfortable. It can help people fall asleep. And there are a handful of studies, almost entirely from one Scandinavian lab, looking at children with ADHD and finding measurable improvement in attention, concentration, and I think overall quality of life with exposure. The potential downside, and this comes from people who study neuroplasticity, is that our auditory system was not designed to listen to everything at once. It's actually designed almost the opposite, to pick out specific individual sounds from the environment. So being blasted with frequencies across the whole spectrum that are activating the entire auditory system at the same time, the claim is that prolonged exposure to that could actually be damaging, and there is clear evidence that tinnitus, and that can be a range of frequencies or a broad or a narrow range of frequencies, but prolonged exposure to that leads to some degradation in brain circuitry that looks similar to the changes we find in dementia. So one is, if you're using white or brown noise, I would not leave it on all the time. I would do it in discrete intervals, and that probably natural sounds, waterfalls, rainfall, uh, surfs crashing on the beach are probably at least as good for relaxation, and probably, because again, they're not hitting every single acoustic nerve cell, probably better for you. So that's what I have to say there. So I do see there's some questions. So Dylan asks, do I find that nicotine gives people with PTSD worsened anxiety, hypervigilance? I have ADHD and PTSD, and unfortunately doesn't tolerate stimulants very well after the trauma. I'm also looking into atomoxetine and guanfacine as potential therapeutic options, and primarily the ADHD symptoms are inattentive. So nicotine is one of the few chemicals that has both alerting, arousing, focusing help, and also tends to be calming, soothing. There's certainly, almost the stereotype of the war vet who has PTSD smoking cigarettes to help calm him down. So there are many people with PTSD where nicotine can be helpful and not particularly triggering of anxiety. But again, individual results may vary. And I certainly do not recommend any smoked or vaped form of nicotine, as there are known toxic effects of those. So either patches or gum are what I would recommend. I'd say also um, snuff or chewing tobacco also has known health effects, detrimental health effects. So I would try to minimize those. Um, and I do have, I think I have a video on atomoxetine. I know I have one. Oh, no, I don't. I know that I have. I'm a much bigger fan of duloxetine than atomoxetine, specifically for ADHD, but in terms of helping with anxiety, the serotonin reuptake component seems to help a number of people on the anxiety spectrum, including some with PTSD. So I would, in general, duloxetine is more likely to be well tolerated and help a broader range of symptoms than is atomoxetine in the context of ADHD with PTSD. Um, Guanfacine also does, again, I can't make specific recommendations, but with the information provided for an individual dealing with PTSD and ADHD together, guanfacine may be a logical starting point. And thanks, Max, for providing the link to the nicotine and ADHD video and to the Stratera atomoxetine video. Hello, Dennis. So Dennis asks, are the stories of Freud using cocaine with his patients exaggerated, made up? I've heard that from a number of psychiatrists, but he's such a polarizing figure, it's hard to tell bias from historical fact. So I am not going to pretend to be a Freud historian. That's interesting. Freudian slip. Historian or biographer. I think it's unequivocal that he used cocaine in his own personal life. Um, I don't know specifically whether he was using it with patients or not. So I'll just have to defer on that. And I think if it really happened, there's probably good documentation of it. Low Bonk 1152. Um, so Max, thanks for forwarding a question from the Reddit channel. So Tadpole Farmer asks, what's my experience with Lamictal for those with autism and autism-related irritability and emotional dysregulation? So the cases or the instances where I've seen lamotrigine, Lamictal be most helpful, and I did have a recent video on whether or not it may be used for ADHD, very limited data there. Are people who are generally in the bipolar 2 category. So it was helping with specific decreasing the incidence of hypomanic and depressive episodes in those, and less specifically for irritability. There is a lot of interest in general in mood stabilizers, whatever their neurochemical class, that many things that help with mood instability in terms of switching in and out of depressive or manic or hypomanic states may be helpful for irritability. But I can't say that I've seen anyone with an autism diagnosis or more broadly causes of irritability who had a clear beneficial response to Lamictal. I'm not saying it can't happen. I'm not even saying it's likely or unlikely. I just saying I have my own limited experience doesn't let me answer that question. So AKSH asks, I have ADHD, how to come out of limerence. Um, so I do have a video on frozen or stuck states and how to help get out of those. Limerence is used somewhat differently by different people. It's sort of some state where you are either focused, obsessed, locked onto something and not engaging. Um, Again, so it's unless it's hard to answer that without a um, clear understanding of how you're using it or what actually the states you're in it entail. So if you want to add to that, you can. I'd say often if you're in a ruminative, repetitive state, we're talking about the default mode network being yeah. So if it here it's AKA Ash, I don't know how to pronounce your handle as Woodward. When they started going to university, they made a best friend. We stayed in the apartment during exams and became obsessed with his presence. Figured out he became a dopamine source for me. So it sounds like, at least in part, that the default mode network, sort of that ruminative focusing over and over, was becoming over engaged. And the more you practice it, the stronger, better you get at that. So part of it is trying to engage other systems. So one is the salience system and trying to focus on other parts of your world, using your sensory systems, using getting involved in a task. Um, Fearing that anxious the person is leaving me, and it's the anxiety about I don't want to make this an exactly a psychotherapy session, but it's the anxiety that you will have problems if they leave you, or that they will have problems if they leave you. And the answer to that is that you were functioning before you met this person, and they were functioning before you met them, and they're likely to continue functioning after that. That's sort of a cognitive behavioral therapy approach, but sort of examining what it feels like you're getting out of this relationship, what this person can do for you, and if this feels like too much energy in one direction, where can there be other sources or people or activities that provide some of what this person is providing for you? Um, I don't know if that's helpful or not. So Bonk 1152 has a quite a long personal question to ask. Hopefully that's appropriate here. I mean, you're welcome to share as much as you can, and I will try to answer it in a respectful and informed way. And if it feels, if it does feel not appropriate, I'll let you know. But hopefully there isn't too much that would be inappropriate here. So Hamad has inattentive ADD and is not sure if the stimulant effect of Vyvanse is working for me. So one, I encourage for any of our mental health conditions to try to find quasi quasi-objective I mean, before you even start medication, to identify what is it that we're trying to treat, whether it's depression, ADHD, or otherwise. What are the symptoms? What are the problems it's causing? and two, to try to use semi-quantitative approaches. So if you know that every day when you start work, you get lost in emails for an hour trying to answer them and tracking things down, and then you take medication and you can get through those in 20 minutes and clear your desk. That would be a sign it's working. I mean, often with the stimulants, someone subjectively has a pretty clear-cut determination. Yes, I feel more focused. Yes, I'm more on track. But again, the more quantitative, we have rating scales that attempt to get at some aspect of that, but they're often fairly crude tools for measuring improvement. Sometimes they're good at detecting improvement, but they can miss it as well. So the other question I'd have is, it's certainly possible that the Vyvanse isn't doing anything for you because it's at too low a dose. And if you can't detect that it's doing much, and so this is my general approach. This is not necessarily a specific treatment recommendation, but my general approach is, if someone can't tell whether the medication is working or not, and they're not having any side effects, then the usual approach is to go up. And with Vyvanse, it would be to go up after 2 or 3 days of not being able to tell. There's absolutely no value to staying on it for weeks, hoping it will suddenly work. That is not how it appears to work in almost anybody. Um, and again, I would not focus or worry about the numbers. There's a huge human variability in terms of what dosage is going to be optimal, what dosage is ineffective, what dosage is going to be too much. And we should be assessing those based on responses, good responses and bad responses, rather than on focusing on the numbers. So I hope that's helpful. Sorry, mm. So AKSH is getting back to the limerence state and being focused, and saying they were so introverted, he made me how to live freely. My dad's got different perspective of life. I'm so attached, and now this limerence drives me crazy. So hopefully you can translate those experiences into understanding that was your own brain, your own body that went out and did those things. Yes, it might have been in the support or company of that person, but it's extremely unlikely that that one person out of 8 billion plus in the world is the only person element that made those situations possible. That was your own brain that did it. And hopefully the biggest gift they gave to you was not those experiences, but knowing that your brain has that capacity to go out and get those experiences and can do so with or without that person present. So it sounds like this was a big impact and a big positive impact in your life. And I'm just sort of pushing, again, without knowing any of the more details, pushing to expand it just sort of a half a step further, that this is showing you what you are capable of, not showing you that you are dependent on this person. So, so Dylan is asking, can ketamine help ADHD? Thanks, Max, who's already brought up the ketamine for ADHD video. Um, Psychiatric nurse practitioners prescribing low dose at home ketamine for depression, PTSD. Is there any chance that it also ends up helping me focus and engage with life? So there is certainly anecdotal information that there are some individuals on Reddit, TikTok, others who claim that ketamine helped with ADHD symptoms. There are absolutely ketamine clinics right now who are aggressively pushing that ketamine helps with ADHD, that it's shown to help with symptoms of ADHD. And I'm not sure how long ago, I think at least a year ago, that I made the video on ketamine and ADHD. There's not a single study on people formerly diagnosed with ADHD, and there is minimal data even on symptoms of ADHD responding to ketamine. Now, that doesn't mean they don't help. It doesn't help or doesn't work. It just means it's completely undocumented territory. And ketamine can help powerfully and wonderfully with depression. I'm not denying or diminishing that, but it is a substance with a clear potential for addiction, clear potential for dependency. Um, there's particularly concern that for some people, stopping it can trigger intense suicidal ideation. There's risk, particularly with ongoing use of bladder, urinary tract infection issues. So it's not a completely benign, and we don't know, since microdosing or low dosing has been less studied less extensively, whether those other risks are lower there. Um, so Bonk is asking me to go on a Google Doc. I'm not seeing a link there. Um, yep, so I can, again, try to answer questions if you want to give a shortened version, or um, I guess I will wait till that comes through or find a link. I mean, hopefully we'll be able to navigate a link while I'm talking here. I do want to respond to, there was a comment recently in the comment section on the inattentive ADHD video I made. So my thought was that the big point I made with the inattentive ADHD video was not claiming that inattentive ADHD doesn't exist. I do believe it exists. My big point there was that the majority of individuals I've worked with who said, I only have ADHD or I have purely inattentive ADHD, the majority of them display a number of impulsive and hyperactive symptoms. Again, they may not be racing around, swinging from trees, standing on chairs like they might have as a kid, but talking too loud, too fast, jumping into situations, interrupting others that are combined, that would make it that it's combined ADHD, not inattentive type. So I don't believe the inattentive doesn't exist. So the person was sort of attacking me for saying I was one more professional who thought it didn't exist because it was just so different from combined type ADHD. And my point was actually the opposite, that many people who claim to have it, it isn't what they're claiming isn't that opposite from others. It actually looks just like others or looks more overlapping with combined type ADHD. So I am not seeing anything further from Bonk 1152. If it doesn't work, just send it right now. You could try emailing it to Dr. John Kruse at gmail.com, DRJOHNKRUSE. Um, so the other things I sometimes mention is that I'm not doing this to generate more practice or clinical patients. I'm actually continually trying to shrink, so to speak, my practice. I'm busy enough with the patients I've had, many for 20 years, and I'm trying to expand on the writing, video and writing dimensions. So I'm happy to try to address clinical situations and questions, particularly when they may have relevance to the greater audience, um, but I'm not here to seek consultations or other new patients. Anybody else with questions? there. So one other topic that I get lots of questions on is how do I come up with topics for my talks? So one is feedback from people like you who are listening in now, and feedback from those who write in on the comments to the videos and or email me. Others are, I don't know, you know, from my weekly, daily reading. So I get the Green Journal, the American Journal of Psychiatry is when I read, usually cover to cover. Um, Also, a fair number of things come from other readings, so items that are in the news in the New York Times, or the Week is a weekly news magazine that tries to summarize opinions from the left and the right, and American Scholar, which is the monthly journal from the Sigma Xi, Sigma Xi, which is a scientific research organization. Um, so I get ideas from a range of sources, and I have no shortage of further topics. So if you have a pet topic, keep bugging me because that will help it rise to the top. So, no one else out there having any questions whatsoever? No concern will end, or sorry, I should not jump into politics. I should also, when I'm answering Dylan's question, NP, I am assuming meant nurse practitioner. It could also mean naturopathic doctor, who in general are not doctors who've gone to a standard medical school, but have other training, um, I'd say less extensively in biology, anatomy, biochemistry, and pathology, but be more focus on other environmental and other inputs to the human body. And it might be helpful actually if someone, yeah, so I can see an interchange between Max and Dylan about, okay, now a sudden bunch of, so Dylan, what are my thoughts on special diets and ADHD? I've heard that some people with ADHD and even autism have found benefits from cutting out gluten and dairy from their diets. Thanks. So the idea that dietary factors are important for ADHD has at least a 50-year-old history. And I think if I say Feinberg, Feingold, there was one child psychiatrist who was particularly interested in and felt that in many cases, additives, particularly food dyes and other food additives, had a detrimental effect on many of his kids with ADHD. So and there do appear to be some people who are particularly sensitive to preservatives, colorants, and others, but in general, more broad stream testing, it did not appear that any of these substances and or sugar had a pronounced acute effect on ADHD symptoms in children or adults. So again, a few individuals may have certain responses, in general, not. Um, so I'd say maybe more in the autism spectrum. I've seen some studies indicating that some people are particularly sensitive to gluten, and that can be detrimental. I've seen much less documentation over dairy, and even people who are classified as lactose intolerant, usually they can tolerate very small doses of lactose, so it's usually a less severe than the extreme of the gluten issues. So I'd say overall, it doesn't appear that gluten or dairy are primary causes of ADHD symptoms or worsening of ADHD symptoms, but there certainly may be some individuals who that is an important issue. And there are certainly aspects of, so celiac disease is a clearly defined severe um, inability to absorb or deal with or respond to gluten in your body. And it can present not just with gastrointestinal, but with some mental health, cognitive issues as well. Um, so I'd say for most individuals, trying an elimination for 1 or 2 weeks of gluten and seeing how you feel, or 1 or 2 weeks of dairy. Usually, if it's having a big impact, you will know that quickly. Theoretically, there could be some people with a slower, it might take a longer time to tell, but that's a fairly easy experiment most people can do if they're concerned. So Dylan asks, is wanting to do things our way a symptom of ADHD or autism spectrum conditions? For example, I have family members who are always asking when I'm going to do X, Y, or Z, and I want to do them all that. But when they ask, I get angry. So I'd say there's, at least I'm hearing two different questions there. So there's no, in the DSM criteria for ADHD, there's no, um, that isn't officially an ADHD um, symptom, although it's quite present in ADHD and it's more, I'd say, closely aligned with autism and maybe with social functioning problems, and that people need to do things in a certain way. And if there's a deviation from that, it just becomes overwhelming. They get flooded. It doesn't work. Where it's pertinent in ADHD is particularly if a multi-step task or a complex task where sequencing is an aspect of what's challenging in ADHD. If you've learned things to do a certain way, then being told that you need to do it in a different order or sequence could be particularly unsettling. Um, and then that phenomena of whether or not you need it to be aligned in a certain way, I would distinguish as a little different from um, being told you have to do things in a certain way, because then there's a rebellion. I, I hope I'm back. I keep getting bad connection signs, so I'm not sure why this is happening more in the last month or so, but I am dependent on Starlink. So what I was saying is that there may be additional psychological components. Yes, many people with ADHD like to be spontaneous, like to do things the way their impulses tell them, and being reined in can make them angry or irritated as well. So I'd say there's two separate dimensions there. So I'm gonna, so the bonk 52 questions on my latest video. I don't have the skills to multitask to check right now, but I will. I'm writing that and I will try to look for that. I will look for that. So Max asks, how many criteria do you need to qualify for a depressive phase? Does a period of fatigue, lack of motivation, and energy suffice to qualify as depression? So unfortunately, and I should know this, I certainly work with lots of people with depression. I don't know in the official DSM criteria how many. You need a major shift in mood, and that can be sadness, or it can be numbness, or it can be irritability. And then you need a certain number of symptoms to officially qualify under DSM 345 for depressive episode, either in a bipolar disorder or unipolar. Interestingly, and one of my next talks will be on the what's coming up with the new DSM, and they are moving away from solely using the diagnosis to identify a specific condition at this time. And by that I mean one of the additions is that they will say, yes, you meet criteria for a mood disorder without the need to specify, is this a depressive episode? Is this a bipolar episode? I mean, if you can specify it great, but allowing diagnosis of conditions into broader categories when we can't define specifically, and more emphasis on severity. Um, so rather than just is it there or not there, are parts of the new, or new and not yet to be DSM. So I'm not sure if, so I would say clinically or in a practical sense, if you have a period of fatigue, low motivation, low energy, and I would hopefully stick in some mood element like either irritability or numbness, or numbness could be lack of motivation, and or sadness, then I'd be likely to say this sounds like depression. Dylan asks, how accurate are online autism adult questionnaires? He scored a 36 of 50 on one of them. Apparently 80% of those diagnosed with autism score a 32 or higher on this specific test. And yes, anti-normal test scores are only 17 on average. So one thing that's highly misleading is that when they are talking about what are the normal range of scores, what are the people who have the condition, those specific numbers are usually coming from administering the test or the screening tool in a specific clear-cut format, um, and usually scored by the administrator, not self-scored. So when they say they're giving you the same questionnaire and the score means the same thing, the context of the testing is not the same. So you can't translate 100 people answering this questionnaire. And if they were taking it over the internet, may have a different. So again, I don't know how much of that got cut off. So again, the context matters. So I don't know that any of these that are claiming certain numbers for what the scores mean, when you change the context from a test situation to just 100 people doing it on the internet, I don't think the 100 people doing it on the internet, the answers provided or scores provided in that context are going to align the same. So that's one thing. Two is, again, almost all these questions are, so one question is what percentage of people have autism who score well or highly on this autism test, versus what are the likelihood of someone with depression, anxiety, ADHD, something else also scoring high on that. So if all they're giving you is people with autism scores and people with, quote, normal, no condition scores, that doesn't tell you how helpful the test is for discriminating or specifying autism. Um, Again, it's nonspecific. It's not telling you. Sort of the important thing is there something else that's going on that might not be autism that's leading to elevated test results. So almost all these questionnaires that are given, furthermore, are not even designed as diagnostic tools. They're designed as screening tools, and I do have a talk on that, which means that they are there to administer simply, quickly, broadly to people to indicate who would particularly benefit from having additional testing. So, so it may be, an informative, it may alert you to a direction, but it almost certainly is not a particularly good or accurate for a diagnosis of a given condition. So hopefully I didn't miss another question of Dylan's. So no, usually the problem with the questions isn't there. Once or twice, things pop up that I can't get rid of, and it makes it hard to read. Okay. So if I missed any questions, Dylan, let me know. And Bonk 1152, I will email it. Again, I don't have the multitasking capabilities to try to read it. And unless there's a long pause and nobody else is answering anything but connected, I see a bunch of comments coming in. Connexive Logic asks, says he's been watching my videos. Have I covered the topic of having ADHD symptomatology in adulthood but not having ADHD? Say something like CDS, cognitive disengagement syndrome, or anxiety. So I have specifically do have a video on cognitive disengagement syndrome. I do have videos on anxiety versus ADHD and PTSD versus ADHD, which are PTSD particularly. There's overlap and confusion and claims that ADHD doesn't exist. So more broadly, we're talking the topic of what's called secondary ADHD. So the official diagnosis of ADHD requires that symptoms exist before age 12. What we know is that most individuals who have it are actually showing symptoms before the age of 5 or 7, which were previous cutoff levels. But that recollection and documentation of that at an earlier age is hard. I am So I also on my chronic fatigue video, I think there are many individuals who have a post-COVID pictures of who develop a full ADHD symptom profile, who did not have it previously, who respond to many of the same both medication and non-medication treatments. So to treat that as an inferior form of ADHD or not real ADHD increasingly doesn't look useful or plausible to me. Head trauma is another situation. Um, so I don't know if, I mean, the other big thing, and I talk about this several times, is that numerous studies of children who were treated for ADHD, and not just treated, but were in formal scientific studies, so you'd think that would register more strongly when they are assessed just in young adulthood, not even in middle adulthood, but by 10, 15, 20 years later, a significant proportion in multiple studies, and that includes more than half of the people deny that they ever had ADHD as a child or were treated for it. And in many cases, the parents, whether or not they had ADHD, also don't accurately reflect or remember that their child had ADHD. So there are lots of problems with our retrospective recreation of what we were like when we were younger. And again, that there may be more severe or intense with ADHD if you're not paying attention, if you're less aware in certain situations of the context or what's going on around you. But it's a issue for all humans. Um, Colleen, thanks, is forwarding information about when I talked about animal studies and intentionality, and specifically with tool use in cows and wolves. Asked what I've seen a study on crows in Seattle And the study there indicated that crows could impart actionable information to each other. So I'm not familiar with the details on that study exact. I am a bird watcher, so I've had a lifelong interest in bird intelligence, animal intelligence, natural world. So I'm certainly aware of other situations. I mean, crows are bright birds. Crows can recognize specific individual humans and come up with appropriate behavioral response. That if an individual is shot at them, may get mobbed by crows. So they're certainly conveying to other crows who weren't even around at the time of any original insult or attack that this is a person to be attacked or made noise of or alerted to that they're danger. So I will see if I can find the crow study. So Dylan asks, what are my thoughts on cerebrolysin? Have you ever heard of it and or used it in your practice? So I have not heard of it at all, unfortunately. I can look it up, probably. Yeah, I mean, just by the name of it, it sounds like some concoction of multiple things. I'll look it up. I don't know. So, Colin, hello. Um, Thanks for being here. Great. Share it with others if others might help. So, thanks, Max. Provided the links to the cognitive disengagement syndrome. Thanks, Dylan, for letting me know I didn't drop any previous question answers. And Connective logic, I was just worried I might be malingering. I have very low documentation. My age is 10 to 13, and I'm running on anecdotes and may mislead my psychotherapist, psychiatrist, probably overthinking, overanalyzing. So there are, I mean, on some more extensive mental health evaluation questionnaires like the Minnesota MME personality index. There are embedded measures in there that actually can detect with fairly good specificity malingering. So malingering is pretending or claiming to have conditions or symptoms. I mean, malingering can exist. Most often that's associated with faking ADHD symptoms to get medications, although, again, the studies are pretty clear. Substantial majority of people who exaggerate their symptoms or who are seeking stimulant treatment do have considerable number of ADHD symptoms. So it's not just a clear cut, as the critics claim, that there are just people who are perfectly fine and pretending to have ADHD to get stimulants. I mean, yes, I'm sure a handful of individuals like that exist, but it's more often much more complex. So my general approach is the more you can share with the person who's evaluating you, so share your concern that you're concerned you might be over focused on certain traits but my guess is how you are presenting in that session itself may provide information to that individual in terms of what's going on diagnostically. Or at least my hope would be that even if you're just there for formal neuropsychiatric testing, there's information about how you interact, how you answer the questions, how you don't answer the questions, how you interact with the researcher, which is good, useful, valuable psychological information. So Dylan's mentioning spending 4 years on clozapine over a misdiagnosis of schizophrenia and then developed stage 4 cancer, multiple surgeries, sepsis, blood clots, and multiple infections. Is my brain likely damaged? That's a loaded question. Sounds like you've been through a lot. And even though I do use it, particularly when pinned down like this, I don't like to use the term brain damaged. I would say we are all shaped by the factors around us. Our brains are shaped by genetics. Our brains are shaped by our socioeconomic and cultural status and values. Our brains are shaped by our family. Our brains are shaped by the traumas we experience and the medications we're exposed to. And the question is if it's shaped us or promoted dysfunctional or unhelpful patterns or problems, how much can we shape it back a different direction? And whether it's medications or whether it's talking therapy, we both know that both of those in numerous situations can result in real changes in the brain. So, yes, there are injuries, damage, as you will, that can result from trauma, radiation, chemical exposure that right now we don't know how to reverse. But I'd say so my focus would be if this is your brain now, what can we do to help you function better and help you be under less distress? And even a brain that's been through a lot of misdiagnosis, bad chemicals, cancer, treatment for cancer, sepsis, infections. Um, so that I also have a talk on perfectionism. So that's why also I don't like the term brain damage. Because I'd say all of us at some level have imperfect brains. And part of our task on earth, I think, is learning how to live and make the most of each damaged brain we have. And unlike certain high-ranking officials in the US government, not inflict our brain damage on everyone around us, which is clearly, unequivocally happening right now. That many, many people worldwide, whether it's from cutting, we have people who are inflicting their own damaged brain on the world at large. So hopefully we can each try to not do that in our own lives. Yeah. So again, I will try to look up cerebral lysine and figure out what I can about it. So sorry about the connectivity problems. I do not think that was Elon Musk trying to censor me just now, and I don't even have any idea at your end because all these pauses have been shorter pauses. So I will get back to bunk 11:52 and read your answer in more detail and probably try to answer it by email. I will look up, thanks for the link to Colleen, the Crow article. I'll look up that and I will try to find more information out about cerebrolysin. Again, I'll be here at the same time relative to mainland USA next week. For some European followers, that may be off an hour because, again, the US is switching to daylight savings time. I think I have this right, this coming weekend. But Europe doesn't do that for a few weeks later, and Hawaii doesn't do it at all. So be healthy, be happy, try to take care of your brain and each other's brains. So I'll end a few minutes early unless there's any last second questions coming in. Okay. Thanks for being here.